Yeah, that strike has begun, and we're seeing healthcare workers from different, again, Kaiser facilities from all over, but 7 a.m. here, this has begun. We have seen some of those nurses and employees walk out from this location. I want to bring in Elena here, who is an ICU nurse at the Zion Medical Center. Elena, you were telling me this is a very difficult decision that this union had to make, but is one that you guys felt was necessary. Why?
Absolutely. We are committed to our patients. That's why we are in healthcare. So it was very difficult to come to this decision at a personal level, and I'm sure with our leadership, with our union, but we felt like we had no choice.
Now, as for some of the things that we've been hearing in terms of what you guys are asking for, staffing, better staffing, saying that the patients need to be taken care of, can you give us an insight into sort of how things look right now? What difficulties are you guys facing when it comes to staffing?
Yes, we are not able to retain our nurses. Talent is going elsewhere because we don't have competitive wages anymore. And as you know, the situation economic in the country is hard everywhere. So our nurses, we train them and then they leave. And so we are seeing a constant turnaround, and we're always just so short with the staff and relying heavily on registry. Patients that, nurses that come from other parts of the country that are not committed to our patients, they are not committed to our organization.
Now, Kaiser says that they pay 16% more than competing hospital systems. How would you respond to that?
That's not true anymore. I've been a Kaiser nurse for 12 years, and I was always very proud and very comfortable, but the reality is that our salaries are not as competitive anymore. And listen, ultimately, this is for our patients. In the ICU, we should always be ready for an emergency, always have a code bed for the patients that are deteriorating and about to die. We should always have that nurse, and that reality is that it hasn't been that way. And so it is my duty to come out and speak out for my patients. I am a patient myself, my entire family, we are all members. That could be me in that situation where we're just scrambling to be able to deal with the emergencies.
Okay, well, Elena, thank you for sharing that insight. And again, this side here, we do want to read what was a statement from Kaiser, at least a part of a statement here. We'll put this up on your screen right now. It says, in part, quote, anything beyond 21.5%, the union asking for 25%, will require us to further increase rates for our members and customers at a time when healthcare costs are increasingly unaffordable and many are having to make the difficult choice to go without coverage. We have a responsibility to do the right thing for our employees and our members and customers. A strike is unnecessary and disruptive. Now, of course, this is only a 5-day strike, but you hear these union members, these nurses, these hospital workers making their voices heard, again, trying to fight for a lot of those things that you just heard Elena talk about.